Hi there, everybody. Bill here. And today we're going to be talking about the most important exams you have to take as a foreign medical graduate in order to obtain your medical license to practice medicine in Poland. So, by now, you might have already heard about the Nostrification Exam. Now, this is the name of the exam that you need to take. Now, the exam is set to test your medical knowledge in clinical medicine, right? So, that's the good news about the notification exam is that they do not really test your knowledge on basic science in comparison to the USMLE, where you have to take two steps. Step one, which tests your knowledge on basic science, such as physiology, biochemistry, anatomy, and so on and so forth. In Poland, they just test your knowledge on clinical medicine. So most of the questions are going to revolve around choosing the correct diagnosis, choosing investigative tests, and also the treatment. From time to time, they might chip in some basic science questions, but overall, you would have like three or two questions in basic science. So if your basic science skills is not really good, don't panic. You're going to be fine. Okay. Right. So that's it. Right. Now, one question that I do get quite a lot is that is it possible to take these exams in English language? And the answer is obviously no. Right. Why? Because you come into Poland, you planning to practice medicine in Poland. Hence, you will be practicing medicine in Polish language. You are going to communicate with your patient to take medical history in Polish language. Hence, the exam is going to be in Polish language, right? There is no option to take the exam in English. With that said, having a decent knowledge of Polish is essential to pass the notification exam, right? So I would say B1 level of Polish is enough to start preparation towards the notification exam. In my case, I started preparation when I was at A2 level, right? How did I acquire A2 level? Personally, I did not really attend any language class. Most of my learning was self learning, using YouTube, using Duolingo, obviously, right? I know many people hate Duolingo because they think the words are repetitive. But if you ask me, Duolingo was really helpful to grasp the basics of the language, to be able to construct simple sentences and also learn words. So, personally, I love Duolingo and it definitely did help. So, I mean, when I started the preparation for the notification, it was pretty tough because in Polish language, the medical terminology tends to be in Polish language, right? And this is also one reason that makes Russian language way easier than Polish language, in my opinion, as somebody who speaks Russian, somebody who studied medicine in Russian. In the Russian language, names of diseases are in Latin. So hepatitis in Russian is going to be like gepatit. Hepatitis, gepatit, pretty similar. In Polish language, hepatitis will be ostre zapalenie wątroba. Tip A, tip B, tip Z, right? So that is quite difficult. Another example would be, let's say, appendicitis. In Russian language is appendicit. In Polish language is going to be zapalenie wyrosta robaczkowego. And trust me, in your exam, you are going to come across these terminologies. They are not going to use Latin. So you need to have a very decent level of Polish. Like I said, it's possible to start your preparation at A2. During my preparation, what I did was that I split my screen into two. On the left side, I had my note in English language. I had all these question banks for the UKMLE. I was using past medicine. And on the right side of my screen, I had my Google Translator. And what I was doing was that I was copying words from the question banks in English and translating these words into Polish language. And I was mostly and particularly focused on symptoms. I was interested in knowing how all these symptoms in English will be in Polish language. Also, I was interested in the names of the diseases and also the investigative tests that you have to order. As I said earlier on, most of the questions are going to revolve around diagnosis, investigative tests that you're going to order as a doctor, and also treatment. Okay, so these are the things that you have to focus on. So, in as much as the language is difficult, it is still doable, right? You can still pass the exam, still having sort of a very not so good level of polish. But once you start to work in a hospital, once you start your stage, you are going to be more confident. You'll be speaking with your colleagues in Polish language. You are going to be communicating with a patient in Polish language. So it is definitely doable. The most important thing you have to do now is to try to reach that A2 level, right? Now, once you have the A2 level, I would advise you to already take steps towards preparing for your notification exam, right? So you do you. If you are good at learning languages by yourself, go for it. If you think you need the help of a teacher, please go for it and try to incorporate all these different applications in your language studies, and you are definitely going to reach your goal.